Are you taking mirtazapine and want to know more about this medication? This video answers many questions about mirtazapine, like what its effect is on the eye, heart, and body weight. How does it cause infections? Let's have an answer for all such questions and many more. What is mirtazapine? Mirtazapine is a medication that is classified as an atypical antidepressant. That means it is a new generation antidepressant with more benefits compared with old generation medications. This drug is a tetracyclic antidepressant. It is well known by its brand name, Remeron. It is indicated for the treatment of depression. This medication can also reduce the anxiety and induce the sleep. It can also relieve the hot flashes in the woman. How does it work? Mirtazapine works by modifying a few chemicals in your brain that elevate your mood. This medication acts by multiple mechanisms. It blocks the alpha-2 adrenergic receptors at the presynaptic neurons. These alpha-2 receptors are normally reducing the release of norepinephrine and serotonin. When these receptors are blocked, these chemicals are more released from the neurons, resulting in their increased levels in your brain. It also acts as a potent antagonist at 5-HT2 and 5-HT3 receptors. This modifies serotonin transmission. Apart from these effects, mirtazapine can also block histamine receptors, which may result in the increased sleepiness. It also blocks muscarinic receptors. That results in anticholinergic side effects. How to take this medication? Mirtazapine is available as a tablet in 2 dosage forms. It is available as normal tablets as well as orally disintegrating tablets. The orally disintegrating tablets that are suitable for the people who are having difficulty swallowing. For treating depression, it can be started at a dose of 15 milligrams. The dose may be slowly escalated to a maximum dose of 45 milligrams. It can be taken with or without food. As it induces sleepiness, it is preferred to be taken at bedtime. For the treatment of post-traumatic stress disorder, it can be started at a dose of 15 milligrams. For treating insomnia, it may be given at a dose of 15 to 45 milligrams per day at bedtime. How does it affect your body weight? Mirtazapine can increase your body weight. It can increase your appetite by modifying a few of the neurons in your brain. It also affects how the hormones are working, and it may impair the sensation of fullness of your stomach. This may increase your food intake, leading to weight gain. Around 7% of an increase in your body weight may be observed with the use of this medication. Particularly, this effect can be observed within the first 4 weeks of the treatment. However, you may also observe an increase in your appetite as long as you are going to take this medication. In order to maintain good health, try to avoid high-calorie food. Regularly check your body weight while using this medication. Try to maintain a balanced diet if you observe any increase in your body weight. Try to cut your portion sizes, particularly with high-calorie food. How does it affect your heart rhythm? Mirtazapine can affect your heart and how it is going to work. It is mostly dose-dependent. It may affect your ECG, particularly, it can cause a QT prolongation. This may result in a few of the cardiac arrhythmias, including torsades de pointes. Under normal doses, the risk of QT prolongation is mild. When mirtazapine is taken at the 45 milligrams dose, again the risk of QT prolongation is minimal. However, this effect may be enhanced with overdosing of this medication. The risk of QT prolongation can be increased by a few other factors. Many medications can increase the QT interval. Therefore, check any other medications that you're going to use that may have an adverse effect on your cardiac rhythm. Sometimes the levels of mirtazapine may be increased by the use of a few other drugs. If you're taking a few antibiotics like clarithromycin, erythromycin, or antifungal agents like ketoconazole, or calcium channel blockers like diltiazem, you may notice increased levels of mirtazapine in the body. All these medications can block the metabolic enzyme, CYP3A4. This reduces the metabolism of mirtazapine, leading to its raised levels. This may affect your QT prolongation. If you observe any fast heartbeats and abnormality in your ECG, this medication may be avoided. What happens if you suddenly stop? Just like many of the drugs that act on your brain, mirtazapine should not be stopped suddenly. On sudden withdrawal of use of this medication, it can produce a few symptoms like dizziness and abnormal dreams. It can also produce loss of sensation. You may have agitation, anxiety, and confusion. It also results in weakness, tremors, and sweating. Therefore, never stop these medications suddenly, particularly when you're under higher doses. Gradually reduce the dose over a few weeks to avoid withdrawal effects. Is there any effect on your eye? Mirtazapine can cause a dilation of your pupils. This is common with many of the antidepressants. However, in people with angle closure glaucoma, this pupillary dilation may further increase the intraocular pressure. This may produce few symptoms like blurred vision and double vision. So if you have any previous history of angle closure glaucoma or raised intraocular pressure, this drug may further impair the condition. Is it suitable for bipolar disorder? Mirtazapine is not indicated for the treatment of bipolar disorder. When you use this medication in people with bipolar disorder, it may produce either manic or mixed episodes. Therefore, before starting the therapy, screening for bipolar disorder should be done. Mirtazapine elevates your mood and reduces symptoms of depression. However, it can also produce other conditions like mania or hypomania. Therefore, if you have any bipolar disorder, this medication should not be initiated. Is it reducing anxiety? Mirtazapine can induce somnolence and increase the sleepiness. This may help in reducing your anxiety. Therefore, this medication can be used in a few anxiety disorders, like post-traumatic stress disorder or obsessive-compulsive disorder. It modifies a few chemicals in your brain that result in increased sleepiness and reduced anxiety state. Even though it is not the first-line agent for treating the anxiety, this medication can be used in a few of the anxiety disorders. Since this medication affects the levels of noradrenaline and serotonin in your brain, it may control the anxiety and reduce the agitation. How it causes serotonin syndrome. Serotonin syndrome is a condition that can be caused by a few medications that increase serotonin levels in your brain. Mirtazapine can increase the levels of serotonin. So it may have a chance to induce this syndrome when serotonin levels are excessively elevated. However, this effect can be observed when this mirtazapine is combined with a few other medications that again elevate serotonin levels in your brain. Is it producing abnormal thoughts? Just like many of the antidepressants, mirtazapine can also produce some abnormal thoughts in the people. With the use of mirtazapine, you may have suicidal thinking. However, this effect can be more observed in the children and young adults with ages under 24 years. Particularly, these effects can be observed within the 2 months of therapy. When you're going to increase the dose, again, this abnormal thinking can be observed. Therefore, take care if you're using mirtazapine in the children and the young adults. In case of any abnormal behavior and suicidal tendencies, this drug should be discontinued. Risk of infections. Mirtazapine can affect your blood counts. It can produce a condition called agranulocytosis. It may result in the development of fever, chills, and sore throat due to reduction of neutrophil count. Even though it is not common in its incidence, you should carefully check these symptoms. In case of reduced neutrophils, this medication may be discontinued. How does it affect your movements? Mirtazapine can produce a condition called akathisia. It may result in the unpleasant restlessness. You are unable to sit or stand still. It is more likely to occur within the first few weeks of the treatment. With an increase of the dose again, this effect may be enhanced. What are the common side effects? Mirtazapine mainly produces few effects on your brain. Particularly, it can produce somnolence, which may result in the increased sleepiness. It also increases your appetite, leading to weight gain. Few other side effects like dizziness, confusion, weakness, and tremors can be observed. It can also produce dry mouth and constipation. These are the essential things that you should know before taking mirtazapine. That's all about this week's story. Thanks for watching this video. If you find any interesting facts on this medication, please share them in the comment box below. Please do subscribe and hit the like button. I will come with another interesting video in the next week. Until then, have a nice time, take care, and goodbye.